students, today I have come with another topic, that is meningitis. So now I am going to discuss about the introduction of meningitis. So meningitis, it is a serious public issues which is caused by the pathogen like bacteria, virus and the fungus, and the incidence rate for meningitis, it is 2.3 million yearly. Okay, next we will be discussing about the definition. So what the definition says? So definition says meningitis, it is a acute inflammation of the meningeal tissues which is present surrounding the brain and the spinal cord. So hope you have understood about the introduction as well as the part of definition. So now let me discuss about the etiological factors for the meningitis. So there are various kinds of etiological factors we can see for the meningitis. So first etiological factor of meningitis, it is bacterial infection. So bacterial infection in the sense the meningitis can cause due to the effect of bacteria in the meningitis. So the bacteria like Streptococcus pneumonia and the Neisseria meningitis are the main cause for causing the disease. Next it is viral infection. So what the viral infection means? The meningitis will be occurring due to the infection of the viruses like enteroviruses and the adenoviruses. Next it can be caused due to the fungal infections also, and next it is immunization. If the children is not taking the immunization like hip vaccine on the time, then it can cause the disease like meningitis. Next, so age also can be a factor for the meningitis. How age can factor means the meningitis will be mostly seen among the under 5 children. Next it is compromised immune system. What is meant by compromised immune system? In the sense, if the children's immunity is too low at that time also, the children will get the meningitis very easily. Okay, so hope you have understood the etiology. Okay, so next we will be moving into pathophysiology of the meningitis. So what the pathophysiology says, let me discuss. Okay, so first of all we will see the pathophysiology. Under that, see, first point, it is bacteria enters into the bloodstream. So first of all, if it is caused by the bacteria, virus or fungus, first of all it will be enters into the bloodstream through any kind of fracture, bone fracture or any kind of opening part of the body, it will be entering in our body. Next, which will lead to enters the mucosal surface of the cavity. So what is meant by mucosal surface? Means the innermost layer of the body. Then it will be entering in the innermost layer or mucosal surface of the body, which will lead to, so next it is breakdown of the normal barriers. So brain has the normal barriers, that barriers will help us from the external injury. Next, which will leads to crosses the blood brain barrier. So after crossing the normal barrier, the bacteria, virus or fungus, what they will do? They will be crossing the blood brain barrier, in the sense it will be entering into the bloodstream of the brain. Okay, next it is which will lead to proliferates in the CSF. So proliferates in the CSF means CSF, it is nothing but cerebrospinal fluid. So in the brain, the CSF will be, the amount of the CSF will be increased, which will leads to inflammation of the meninges. After that we can see the infection or inflammation into the meninges. Okay, and which will leads to the intracranial pressure increase. So what is mean by intracranial pressure? In the sense, the pressure which is exerted by the skull, brain tissues, blood and the CSF, and which will lead to meningitis for the children. Okay students, so next we will be studying about the clinical manifestation for the meningitis. So first clinical manifestation, what we have seen among the children, it is hyperthermia. Okay, due to the inflammatory process there will be, obviously we can see the hypothermia, then stiffness of neck. Stiffness of neck, it is nothing but the children will be not able to move the neck, and there will be headache for the children, and then there will be complaint of the repeating vomiting of the children. Next, it is photophobia. Photophobia, it is nothing but the light sensitivity due to the infection process. Next, it is drowsiness also we can see, and joint pain also we can see among the children. Then confusion, okay, confusion due to the increase of CSF fluid, okay. Next, it is seizure attack also we can see among the children, and if it is going to extend limit, then the children may go for the coma also, okay. So next point we will be discussing about the diagnostic evaluation, okay. So under diagnostic evaluation, the first point it is history collection, okay. So under the history collection, mainly we want to collect the history about the immunization of the children, means whether the children has taken the hip vaccine in a time or not. Next, we will be seeing about the recent exposure of any kind of animal, okay. Then we want to check for whether the children has been exposed any kind of person who has been got the meningitis before, or any family history regarding the meningitis. So that was all about the history collection. Next, we will be moving into the physical examination. So under physical examination, basically we want to check the size of the head, okay, because we have seen in the signs and symptoms that there will be increase of CSF fluid. So for that, the size of the head also sometimes it can increase, okay. So we want to examine the head of the children, okay. Next, it is stiffness of neck. Stiffness of neck, it is like the children will be not able to move the neck, so that we want to also examination, we want to do the examination for the neck also, okay, due to the neck rigidity. Next, it is we want to check for the Kargin sign. So on the Kargin sign, what we want to do, we want to extend the hip and knee into the 90-degree angle, okay. If the children is facing any kind of difficulties or any kind of irritation while extending up, so this is a positive signs of the meningitis, and we can come to know the children is having meningitis. So next, it is analysis of CSF. So analysis of CSF means examination of CSF we want to do to know the causative agent of the meningitis. The bacteria or viruses will be floating in the CSF, so we can finding out through the analysis of the CSF. Next, it is we can go for the CBC test also, okay, to finding out the causative organism. Next, it is CT scan we want to do, okay, CT scan, and MRI also we can do, then X-ray also we can do to finding out the disease condition. Management of the meningitis. So first of all, we are going to see the medical management of meningitis. So under medical management, first and foremost, the priority we want to give for the antibiotic medications, okay. So antibiotic medications means we can give the ampicillin medicines, penicillins and amoxicillins to the children, okay. Next, it is antiviral medication. If it is caused by the viruses, then we want to give the tenofovir for the children, okay. Next, it is antifungal. So if it is caused by the fungus, means we want to give the medication like fluconazole, okay. Next, also we want to give the antibiotic medication, means after that, after completing the antibiotic, antiviral and antifungal drugs, so we want to move into the symptomatic management, okay. So according to the symptom, we want to give the medicine. If the children is having hyperthermia, then we want to provide the antibiotic medication. So under antibiotic medication, we can give the acetaminophen to the children, okay. Next, we want to give the antiemetic medication if the children is frequently complaining about the vomiting, okay. Next, we will be discussing about the nursing management part, okay. So what is the nurse's role? So on the nurse's role, the first point we will be discussing about our first priority we will be giving about the reducing the fever. So under reducing the fever, we want to first of all, how to reduce the fever means we can give the tepid sponge bath to the children. Okay, and also we want to frequently check the vital signs, that is every 2 hours. Okay, next it is also we want to give the comfort devices to the children. Okay, next we will be moving into the maintenance of the fluid volume. So maintenance of the fluid volume, under that the first priority we want to give the IV therapy. So we want to provide the IV therapy to the children, and next also we want to monitor whether the input and output it is going on properly or not, whether the how much the children is taking by the mouth and how much the children is excreting, that we want to check it. Okay, next also we want to monitor the CVP line. Okay, so next priority we want to give about the pain. Okay, so here we want to assess the level of pain, then pain intensity, duration of pain, and location of the pain. And the next one it is we want to give a darkened room for promoting the complete rest and sleep to the children. Next we want to provide the comfortable position, because the children is having the complaint of stiff neck, that is the children will be unable to move the head, so that we want to provide the comfortable position to the children. Next it is elevate the head of the bed. So elevate, how to elevate, in the sense we want to rise the head part of the bed, or we want to provide some kind of headboard under the head, so we can elevate it, and the intracranial pressure also will be decreased. Next it is we want to provide the diversional therapy for the children, so they can divert their pain from they can divert their mind from the pain. Give vaccines. Then also we want to ask the patient for washing the hands frequently. Then we should not we should not allow the children to play with the person who is having the cases like meningitis. Then we want to avoid the close contact of the meningitis patient. Then also we want to disinfect the surface regularly. Then also the children has to maintain the personal hygiene properly. Okay, so hope you have understood the class. Thank you for watching this video.